Welcome back to the Joust About Careers podcast, where you can learn about careers from people who are actually in the trenches every day. I'm your host, Brian Brott, and I'm a career advisor and English teacher at Van Buren High School who wants to see all people make good career and life decisions. This episode features the highlights of the interview with Sarah Benson, who is a general surgery resident. Sarah shares about her life as a resident, potential college majors for someone pursuing a pre-med degree, what she wishes someone had told her about the healthcare field when she was in high school, and the challenges and rewards of a career as a general surgeon. If you like what you hear from Sarah and would like to learn more, you can always watch the full interview. Until then, enjoy the show.
Yeah, so as a general surgery resident, I'd say I do very little sleeping and I spend a lot of time at the hospital. So my program, we take call. So that means that 1 to 2 times a week, I work a 28-hour shift. In between that, my shifts are about 12 to 14 hours long, just depending on the workload. I get here at like 5 o'clock. I go home at 5 or 6 at night. And if I'm on call, it starts at 5 in the morning and it ends at about 8 a.m. the next day. So long shifts here. For the most part, I'm gathering all the information about my patients on the service that I'm covering for the day. I'm writing the notes. We round as a team on all the patients, and then we take care of the floor work, get patients to the OR. Depending on the service I'm on, I get to go to the OR and operate. Yeah, or I'm mainly on the floor if it's in the critical care unit. So it's just a little bit of everything. Yeah, I have 90 cases where I've been able to be the first assist in the case, which means I'm pre-opping the patient, getting them ready to go to the operating room. I get to go back. I'm making the incision. It's usually one-on-one with my boss, the attending surgeon, and he walks me through the case, but I'm the one throwing in the sutures. He tells me if I'm doing it right, if I'm doing it wrong, and of course corrects me as I go. But yes, that's been very surprising. But as an intern, a first year, I've been able to do quite a bit. Yeah, so I went to Hillsdale College. I was a biochemistry major. It was a great combo of biology and chemistry, and it's a great pre-med major because it has all the pre-med classes within the major, which is why I chose it. But a lot of people choose biology, chemistry, kinesiology. You really can major in whatever you want to go to medical school as long as you get the prerequisite classes in. So I chose biochemistry just because it piqued my interest the most, and it was the most time efficient major, having a track career as well to focus on. I didn't want to get myself in too deep with studying too many things and not be able to balance it all. Yeah, so most people, either their junior year of college or their senior year of college, they apply to medical school. I did so my senior year just because I had that extra 5th year, and I did my research for my thesis my junior year instead. But getting accepted to medical school, it's typically rolling admission. And so I knew in October of my 5th year that I was going to go to Toledo. I personally chose an in-state school just because people go into so much significant debt in medical school. It just makes the most sense to choose an in-state school where the tuition is lower. And so I chose Toledo. It was an incredible medical school to go to. And it was close to home, which was so helpful for the rigorous hours of medical school. Medical school is another 4 years on top of it. Okay. Typically, it's 2 years of book work and then 2 years of clinical experience. Yeah, so your 4th year of medical school, you start applying to residencies. There's a big date in March. It's called the match. And so It's like March 15th or March 18th every year. Every single medical student in the country finds out where they matched.
Oh, wow.
So I matched at Trinity Health in Ann Arbor. So our program here is 5 years long. So those 5 years the 5th years I'm talking about, they're almost on their way out. Other general surgery residencies are 7 years. They have 2 years of research combined in them. We call those more of like the academic programs for people who are interested in going to like the Ohio State University Medical Center or University of Michigan. My program is more of a hybrid program. It's very hands-on from day one. So we just have 5 years, no research required. And then at the end of 5 years, you can choose to go on further into your studies essentially and do a fellowship. There's like colorectal surgery, breast surgery, trauma surgery, cardiothoracic surgery, all different fellowships that you can choose, or you can choose to just go out and practice as a general surgeon. What you do during your general surgery residency is that you spend time in general surgery, of course, which is like breast surgery, thyroids, hernias, taking out appendixes and gallbladders, but you also you spend many months on colorectal, vascular, you spend time in the critical care and trauma ICUs, on the trauma services. So by the end of residency, even if you decide to be a general surgeon, you still have experience in all the different fields. Your scope of practice isn't the same as, say, like a colorectal surgeon's practice would be, but you're trained in all of those specialties. Something I wish someone would have told me back when I was in high school, not saying it would have changed my route at all, but there are so many different ways you can impact people in the medical setting and so many different areas of practice within the medical setting that are interesting and fast paced and, that are so important when it comes to patient care that I wasn't aware about, like respiratory therapy and occupational therapy, physical therapy. You can be a case manager and like really get in the nitty gritty about people's lives and what it looks like when they discharge from the hospital, making sure they have a good home life. There are so many cool people in the hospital. So if you want to be in the hospital or you want to be involved in medicine, but you don't necessarily want to spend 15 years of your life getting there, there are so many other things you can do, including like physician's assistants and nurse practitioners. There's a whole team of people in the hospital. And so time is huge. You have to just accept that you're going to give that amount of time of your life up if you want to be a doctor. So if you're not willing to do it, there are so many other things you could do to still be involved. I'm pretty hands-on. Like my dad loves to work on cars. He loves to build things. And so I grew up, just working with him and building things. And so I thought that that would be the easy part of residency, that I'd catch on very quickly and that a surgery would come naturally, should I say, which I was so wrong. That it's very complex. There are so many things to learn every single day. And it terrifies me that, you have 5 years to learn it. It almost feels like it's not enough time. My first month I spent in the surgical ICU. I had a patient who's there for almost the entire month. And so it's kind of rare in surgery. And I was able to build a really incredible relationship with the patient and his wife. And so that was just so rewarding to me, is to see him come in as a very critically ill patient and then be able to leave like a month later and be back on his feet. And, just to see like his family's whole journey through that process and to see them on the other side. You can't expect the right things to be easy. I would almost expect them to be hard, and to know that they're hard because if it means enough to you, you have to put enough effort in to get there. And that if you're not being challenged in that way, how will you ever like truly know that is what you're supposed to do? Because you have to be challenged to make that decision.
Wow.
So to like embrace the challenge and to enjoy it and to like fine declaration of, what you want to do within it.
Thank you for watching and listening to this episode of the Joust About Careers podcast. I hope you learned valuable information from this career story, and to be sure you don't miss upcoming episodes, please click subscribe on YouTube or your favorite podcast platform so you'll know when the next episode is released. Thank you for watching, and as always, this is the place to go to learn just about careers.